All right, this is my last attempt. I'm trying to keep it under 3 minutes, and then I realized you don't need to hit every single prompt. It says you're doing a short news report. Pretend this is to a friend. So my dissection, I started off by debriding all the skin and fatty tissues so I could reveal the muscle. This was so that I could have a clear look of how the muscles were contracting as I moved the hinge or the synovial knee joint, whatever you want to call it, and as well as the ball hip joint slash hip joint. I did this and then I dissected it further, removed layers of muscle like the gastrocs, so I could reveal the Achilles tendon, remove muscle around the knee, like part of the quad muscle. Well, I don't know if it's really a quad muscle, but part of the quadriceps, if we were to look at it from a human perspective, so that we could see inside and see the patella as well as the tendons that were attached, and then the internal ligaments of the knee, like the meniscus, ACL, LCL, MCL, and PCL. We also saw, I forget what tendon, it's like a hip flexor. I don't know what the actual name for the hip flexor is right now. It's just lost my mind, but I did snap a hip flexor in my chicken's hip. I spun it really hard and broke it. So some movements that I noticed about the chicken leg that were really similar to humans were how much the knee hinges. It didn't allow for any medial rotation, lateral rotation, or just any pulling medially or laterally. Like you could a little bit, there's a little bit of give considering the chicken was dead, but compared to like a human knee, it was very similar as it was only made for flexion and extension to propel yourself forward or to like slow yourself down or sit and raise. I thought that was really interesting. I don't know how I thought chickens walked, but it was not that I thought they were the exact same as humans. Um, some structures that I saw, I've already listed a couple. We saw long bone, which was the equivalent of the chicken femur or a human femur, but they only really have one major bone in their knees. So that's that. But we did see a long bone, and when we cut it open, we did see a medullary cavity, the spongy tissue, an epiphyseal line, and red blood cells, which is what made up the spongy tissue. What else did we see? I listed all the tendons. We did see cartilage. We did see patella, like the patella. When articulating cartilage is removed, it causes osteoarthritis or just arthritis, which is where the bones are gnawing on each other. That's typically something that comes with age because cartilage starts to deteriorate at any time, especially if you're an athlete. They say receivers may have the worst knees. Starting to see it. My mom has no cartilage in her knees. You have no cartilage in one of your knees, I'm pretty sure, if I remember correctly. What structures are exposed? The bones, your knees. Typically, it's in your knees. It can be in your fingers, shoulders, whatever. It causes grinding sounds. I hear grinding in my shoulder. My cartilage is a little bit damaged. Germany's working on stuff to fix that. The main function of the movement of the knee joint is to propel, to push forward, flexion, and extension. And so you can sit and raise and then push and slow. Well, pull, I guess. Um, what are some knee joints and injuries that affect younger children? Jumper's knee, which is where patella tendonitis, which is just a whole bunch of micro tears. In some cases, they become larger tears in the tendons that are attaching the patella to your like knee and your tibia. This can cause insane pain. Basically, it hurts to kind of press into the ground or put any pressure onto your knee. It's common in basketball players, um, wide receivers, and then some track athletes. Another issue is Osgood-Schlatter, which is where if you grow so fast, your patella tendon on the base of your knee pulls at the growth plate on your tibia. I have had that actually the worst pain I've ever had on my knees in my life, minus a helmet to it a couple times. Like it can be surgical if it's bad enough, and I was almost there. 0 out of 10 recommendation. Um, how does it affect you? You can't have fun. You can't really do anything. I remember sitting there like this hurts to run. I'm 13. What the heck? I grew like a foot in a year. It got really bad. Connective tissues that we saw, I already told them the tough ones to break. When I was rotating my knee medially, I was doing that so that I could snap it and hear all four ligaments plus the meniscus tear. I had already torn my meniscus with my knife. Big shocker. Wasn't the most delicate person. That's kind of everything that I really noticed about my chicken's dissection. I'm trying to be concise. I'm also over the 3 minute time limit, and this is my last attempt. So I hope my write up is very good. I don't have a drawing because there was no screenshots. I didn't take photos. You took all my photos.